Welcome everyone. My name is Dr. Chris Irwin,
And my name's Dr. Umair Masood.
co-founders of this revolutionary new app called Consultnote.AI.
We are here to show you today a simulated patient consultation to show you how the app works.
You will be absolutely amazed at what the app does. So without further ado, let's watch it together.
Indeed.
Hello Umair, absolutely lovely to meet you. My name is Dr. Chris, one of the doctors here at the clinic. How can I help today?
Look, I've heard you're a very good doctor. That's why I've come down here today for the first time.
Thank you.
I've come in here because I think I've hurt my knee.
Oh, that's no good, Umair. Now, just because it's the first time we're meeting as patient and doctor, is it okay if I ask a few questions first?
Of course.
Now, Umair, on the software here, it says you're 70 years old. Is
That's
that right?
it. Yeah.
Yep, fantastic. And Umair, do you have any medical problems that you're aware of?
I've got a little bit of a blood pressure problem, and my cholesterol level's a little bit high.
Okay. Yep. So I've got a little bit of a blood pressure problem, and some mild cholesterol issues. Now, in terms of medications, are you on any medications for those problems?
Yeah. Cavasol 5 milligrams every day.
Yep.
And Crestor 5 milligrams every day.
Okay, good. Now, Umair, do you smoke at all?
No.
No, fantastic. And with alcohol, how many days a week would you normally drink alcohol?
Oh, I have about a glass of whiskey every day.
Okay, good. Now, in terms of your family history, Umair, do any illnesses run in the family?
Diabetes is a big thing in my family.
Right. So who in the family has diabetes?
Look, mum, dad, my uncles, my aunties, type 2 diabetes is a big thing in my family.
Oh, cool. And that's something definitely, if I'm to be your normal doctor in the future, that's definitely something we should talk about, and maybe we'll talk about it after we've dealt with what you've come in with today. Now, tell me, how can I help you today, Umair?
So look, the main thing is my knee, right? So I was playing cricket. I used to be a very good bowler many years ago.
I'm sure you were.
but while I was trying to bowl, I was pivoting on my right knee.
Yep.
And I think I've done something to it. So quite painful. Happened about 4 days ago.
Okay.
It's a bit swollen as well, and I'm limping around at the moment.
Oh, that's not good at all. Have you hurt your knee in the past?
Never.
No? Okay. Now, when it happened, can you describe the exact moment, sort of when it happened?
So it was that twisting movement that actually did it.
Yep.
And the pain was mainly on the inside of my knee.
Yep.
And it swelled up quite straight away.
Oh, no. Can you walk on the knee?
With a limp. I'm hobbling pretty much.
Okay.
At the moment.
Yep. And is it sore?
It's a little bit sore, and I think it's still fresh from 4 days ago. So
Yep. And if you had to rate that pain out of 10, what sort of level do you think it would be?
when I'm walking around, maybe 6 or 7. When I'm sitting down, maybe 4 or 5.
Oh, well, that sounds like quite a bit of pain there, Umair. So I definitely think we need to sort it out. Just with things that make it better or make it worse, does anything make it better that you've noticed?
Not look up when I rest, it seems to be a bit better.
Yep.
But when I'm walking around, it's quite painful.
Okay. And have you tried any Panadol or Nurofen or anything like that?
I don't think it's helped.
Okay. Yep. So you have tried some.
Yes. Yep.
Okay. Now, what about things that make it worse? Like, have you noticed if going up or down stairs makes it worse?
Yeah, a little bit. I'm not sure. I can't remember whether it's up or down, but it does get a little bit funny.
Yep.
And I'm not really trusting the knee as much.
Oh, right. Okay, that's no good. Has it given way on you at all?
No, but I've often thought, could it give way?
Yep. And what about, do you feel like it's about to get locked or catch in position sometimes?
And again, I've felt like it could, but it hasn't.
Oh, right.
It feels just a bit weird.
Okay. Now, well, Umair, do you mind if I examine your knee?
Of course.
So on examination, we've got a very swollen right knee with a positive patella tap indicating an effusion, but we can't see any cuts or abrasions. We've got a closed injury here. Now, Umair, you just tell me where the joint is sore.
That hurts.
Okay, yep. So we've got some medial joint tenderness on the right knee, and I'm just going to test your ligaments, Umair.
Oh, that hurts a bit.
Okay. Now, and then can you raise your leg straight for me? So we've got a normal straight leg raise. And then finally, I'm just going to test your meniscus there. So you just tell me if this hurts.
Ooh, yeah.
Yep, so I can feel a clunk, and we've got a positive McMurray's for the medial meniscus on the right knee. Thanks for letting me examine your knee, Umir. Based on examination and history, I'm concerned that you may have a medial meniscus injury on that knee, which is a really common problem to do with the cartilage inside the knee. To diagnose it properly normally requires an MRI, but when we're 70 years old, normally the treatment is conservative with physiotherapy. So what I would like to do for the knee, as long as you're happy, is we'll organize an x-ray of the right knee just to make sure there's nothing broken. And then assuming that's normal, I'd like us to do 6 weeks of physiotherapy, and then we'll reassess it after that if we've got any ongoing problems. Do you have any questions about that plan?
No, that sounds very good.
Well, that's fantastic, Umir. Now, what I'd like to do is also just go through some preventative health, and I'll use this program to sort of help me go through it a little bit. Now, when was the last time you had your blood pressure looked at?
About 6 months ago.
Okay. And was it okay then?
Yes.
Yep. And then in terms of your blood tests, looking at your cholesterol and your sugars,
about 6 months ago.
About 6 months ago. And how were they?
They were all apparently okay.
Okay, that's good. Now, there's a special poo test to look for colon cancer we call the fecal occult blood test. Have you had that done in the last couple of years?
I've missed the last one. I think you're supposed to do it every 2 years, right?
Absolutely.
Yeah, I think I missed the last one.
Well, what we'll do when we see each other next, we'll organise your fecal occult blood test. And then also, you said you had bloods done 6 months ago. Do you know if that included your diabetes screen, looking at the sugars?
Yeah.
Fantastic. That's really important given your history. Now, with vaccines, have you had your flu shot this year?
I have that every year.
Fantastic. You've had it this year? Fantastic. And what about your pneumonia vaccine?
I had the pneumococcal vaccine. Yep.
And how long ago was that?
Oh, just when I turned 70.
Okay, fantastic. So quite recently. Yeah. Okay, good, because you only need that once.
Yes.
Now, what about your shingles vaccine?
I was supposed to have that, but I haven't had it done yet.
Okay. Now that's something that we should also perhaps organise on our next consult. Now, just looking through sort of other extended health screening, in terms of bone density, or what we call DEXA scans, have doctors talked to you about weak bones in the past?
Look, I was given a form to go get it done, but again, I haven't had it done yet because I went overseas. So I sort of thought to myself, I'll do it when I get back, and I forgot.
Oh, okay. Well, fantastic. Well, I think that's another thing that we'll organise on a next visit. We'll get a DEXA scan done. And with your regular doctor, has your regular doctor talked to you about the pros and cons of prostate cancer screening before?
Yes, I heard there's a bit of controversy, right?
Yes, yeah. And have you had your prostate checked in bloods?
No,
never.
No.
Okay. Well, maybe that's also something we'll go into depth next consult as well, just so that you're completely informed about the pros and cons of it. Well, I think that's been a really good consult, Umir. So we'll get the right knee X-ray. We'll start the physiotherapy, and then when we see each other next, we'll go through that preventative stuff in more detail. Is there anything else you think is important before you go?
Yeah. Look, I forgot to mention. I went overseas recently. I went to Italy recently.
Oh, that sounds lovely.
Yeah, Lake Como.
Oh, really?
Yeah, you should go
I've never been to Lake Como. I heard George Clooney does he live there, or has he just got a house
there?
Well, that's amazing. Good for him.
Yeah, and my wife wanted to go and find the house, so we wasted a whole day trying to find the house.
Oh, that's a shame.
Bloody awful. Anyway, but look, when I came back, you should go, by the way.
I really want to go. I'm so sick of Melbourne winters.
Fair enough.
Yeah.
But look, I've been feeling a bit short of breath, and I've been having this chest pain since I got back.
Oh, really?
Yeah.
Like, just remind me, when did you get back?
About 4 days ago, on the day when I was playing cricket.
Oh, right. Okay. Okay. So how long have you been feeling short of breath for?
Pretty much for the full 4 days.
Okay.
Just a bit puffed out. Everywhere I walk, I feel a bit sort of puffed out, which I'm normally not.
Okay. That's no good at all, Umir. And you said you've also got some chest pain.
When I take a deep breath in, otherwise it's not really painful.
Okay. And how bad is that chest pain?
Ooh, I'd say maybe 5 or 6 out of 10.
Okay, well that sounds still pretty reasonable. Would you describe it as a sharp pain?
Very sharp.
Okay, so you've got a sharp pain when you breathe in. And where in the chest is it again?
I think it's more on the right-hand side.
Maybe more on the right-hand side, okay. Now, any other symptoms, like if you notice a cough, for example?
A little bit of a cough, nothing crazy.
Yep.
Not bringing anything up.
Yep, so no sputum?
No. Maybe I felt a bit feverish, but I thought, jet lag possibly, so I didn't really think too much of it.
Okay. Have you recorded your temperature? Have you taken a thermometer recording?
I tried, but the batteries were out.
Always happens.
Every time you want to use something.
Okay, so we've been feeling hot, a bit short of breath, and you've got some chest pain worse than you breathe in. Have you noticed any coughing up, any coughing up of blood or anything like that? No. And no sweats or night sweats? No. And you weren't sort of at an exotic animal farm in Lake Como with the birds or anything like that?
No, not at all.
Okay. Now, and then just going back to your family history, like we talked about the diabetes, is there any family history of blood clots or anything like that?
No, nothing I can think of.
No. And we've had that recent travel, but you haven't had any recent surgery? No. Okay. And with your calves, how are your legs feeling?
Yeah, fine. Look, apart from my knee, the legs are fine. The calves are okay.
Okay, yep. So there's no pain in your calves or anything like that? No. Okay. Umir, do you mind if I examine your chest and do those sorts of things?
Yep.
Yeah. Okay. Umir, so I've had a real good listen to your chest and done your vitals, and I'll just explain those, and then where I think we should go to from here. Now, you have a mild temperature at the moment, so you've got a temperature of 37.8 degrees Celsius. Your heart rate is a bit fast, so your heart rate is 105 beats per minute, which is a little faster than what we'd consider normal. And also your oxygen in the blood is a little low, so what we call your saturations are only 93% on room air, which is a bit lower than what we'd consider normal. Your blood pressure is really good though, at 120 on 80. Now, when I've looked at your ears look perfectly normal, so the eardrums are normal. Your throat looks normal. You've got no lymph nodes up in the neck, what we call cervical lymphadenopathy, which is good from an infection point of view. When I listen to your chest, though, I can hear some really loud crackles in the bottom left lung, which isn't normal and just makes me concerned that there could be something going on in that lung. When I've examined your heart sounds all perfectly normal, so completely normal cardiac examination, which is really good. Now, based on all of these things, I'm concerned that we may have what's called pneumonia, or a serious lung infection, or potentially what we call a pulmonary embolus, which is a clot that we can get in our lungs sometimes from travelling.
Those are not good, are they?
No. So they're not good. So we definitely need to look into this. So what I want to do is I want you to have a chest X-ray urgently, and I want you to have some blood tests. So we're going to order a few blood tests. We're going to order what's called a full blood count, a UEC, which is looking at the salts in the blood. We're going to do a look at the inflammation in the blood called a CRP, and we're going to do a D-dimer. Actually, one thing I forgot, Umir, do you mind if I have a look at your calves for a moment?
Of course.
Yep, fantastic. You see your calves are really soft, they're not sore, and they're the same on both sides, which is really important from a blood clot point of view.
Good.
Well, getting back to the plan, we should do those chest x-ray, we do those bloods, and an ECG as well to look at the heart. Now, I'm also going to write you a letter for the emergency department, just in case you're feeling at all worse when you get these tests done. I don't want you to wait and come back to me. I want you to go straight to the emergency department. That's what I feel we should do, Umir. Do you have any questions about that plan?
No, that sounds like a good plan.
Okay, well, fantastic. Well, let's get all that done, and then we'll see each other really soon, and we'll make sure that you're good and healthy.
Thank you.
Now, after the consult has finished, and you've pressed the stop listening button, and pressed the general consultation button, after about 30 seconds, this summary, this AI-generated amazing summary of the consultation you've just heard will be shown. And I really don't believe that there was really anything missed on that. So that's quite amazing. Now, during consults, something that I often do is I use the smart letter function. Now, this is a letter in which the AI very intelligently writes your referral letter for you, saving you literally hours a week of work. So this is the letter here. My tip for using this function is you can do it during your consult. You simply press the stop listening button. You then enter the specialty you wish to write the letter to, and then you write the subject, just remembering you're not constrained by by a few words. You can put a sentence or two in there, and the output is as you see. Now, usually the output is fantastic and not really need to be edited in any way. But if you want to, of course, you can edit this. You can edit in whichever way you wish before copying this, putting it into your electronic medical record and putting it in a normal letter software. This is the preventative health part of the program, which I would recommend that all GPs really use, because we as GPs should be the experts in preventative health, and I'm very, very passionate that every single GP really should trying to be presenting some form of preventative health into every single consult they have. And our software, Consultnote.AI, makes this simple. So as you can see here, it literally just puts step by step the recommendations for both lifestyle as well as screening for your patient based on the consult. And it's based on the RACGP Red Book, so the absolute best advice in Australia. And then also we combine that with the best guidelines around the world. So that's a really useful function. What have I missed is a very, very useful function of the AI for both junior doctors and senior doctors that just really want to stay at the top of the game. And I often use it in consultations where I just feel a bit off, that maybe I'm missing something. I can't really put my finger on it. And it's a really good way just to get another view on the consultation and things that you potentially should have considered. It's also very helpful for junior doctors, specifically with their thorough review of systems, as well as just giving general advice from the AI in terms of how we could have improved the history taking and physical examination as well. The differential diagnosis tab is quite self-explanatory, and then options in terms of investigations and differential diagnoses to consider. And finally, I often use the treatment information from Consultnote.AI not as a trusted guideline, so we should always base our treatments on our clinical knowledge and our textbooks, so we should never rely on AI for our treatment advice. But often it's a great way just to double check things when you're 99% sure that you're on the right track and you just want a very quick refresher without looking like you're Googling something in front of the patient. So you'll never have to Google anything again with Consultnote.AI. And as you can see, there are many more functions of Consultnote.AI that we haven't covered in this video, but are on the how to use part of the website. We hope you're as excited as we are about this revolution in healthcare, and we hope to see you soon. Have a lovely day.